January 13th, 2004. Inside Wakefield Prison, one of Britain's most notorious prisoners was found hanging in his cell. The man was 75 years old. He had been a respected family doctor, a trusted general practitioner, a man who had spent decades caring for his patients. Or at least, that's what everyone believed. His name was Harold Shipman. To his neighbors, he was polite, professional, quiet. To thousands of patients, he was simply Dr. Shipman, the man they trusted with their lives. But behind the white coat was something far more sinister. Investigators would eventually conclude that Harold Shipman had murdered at least 215 patients. Later inquiries suggested the true number may have exceeded 250. Though those additional deaths were never tried in court, he became Britain's most prolific known serial killer. And perhaps the most chilling part of all, he never confessed. He never explained why. He took the answer with him to the grave. This is the story of the doctor who betrayed an entire nation. Harold Frederick Shipman was born on January 14, 1946, in Nottingham, England. He was the middle child of a working-class family. Friends later described him as intelligent, reserved, and academically gifted. As a teenager, he excelled in school, especially in science. He seemed destined for a successful career. But during his teenage years, something happened that investigators and psychologists would later revisit again and again. His mother, Vera Shipman, was diagnosed with terminal lung cancer. As her illness progressed, a local doctor regularly visited the family home. To ease her pain, he administered injections of morphine. Young Harold watched everything. He watched the relief that came after each injection. He watched medicine ease suffering. And eventually, he watched his mother die. Whether those memories influenced what he would later become remains one of the great unanswered questions of the case. No one can say for certain, not even the experts. Shipman graduated from medical school at the University of Leeds. He qualified as a doctor in 1970. To colleagues, he appeared capable, hardworking, confident. He began practicing medicine in Yorkshire. Then, only a few years into his career, his professional life nearly ended. In 1975, Shipman was discovered forging prescriptions for the powerful opioid pethidine. He had developed an addiction. Instead of obtaining the drug legally, he created false prescriptions in patients' names. He was prosecuted, fined, and convicted. Many assumed his medical career was over, but it wasn't. After treatment for his addiction, Shipman returned to medicine. Over time, he rebuilt his reputation. Eventually, he opened his own general practice in Hyde, Greater Manchester. Patients respected him. Many admired him. He was known as an old-fashioned family doctor. He made house calls. He listened carefully. He rarely referred patients to hospitals. To many, he represented exactly the kind of doctor people wished still existed. Buck. And that trust would become his greatest weapon. By the late 1980s, patients were dying. Most were elderly women. Many lived alone. Most deaths appeared entirely natural. After all, where people trusted their doctor, if Dr. Shipman certified the cause of death, the few questioned it. He often visited patients in their homes, sometimes only minutes before they died. He would later certify their deaths himself. Family members believed their loved ones had passed peacefully. Police saw nothing suspicious. Funeral arrangements were made. Life moved on. No one realized they were looking at the early years of one of history's longest-running murder sprees. Over the years, something strange began happening. Other doctors noticed that an unusually large number of Shipman's patients seemed to die at home. Many were found sitting upright in chairs, fully dressed, appearing peaceful. Most had been alone with Shipman shortly before their deaths. Still, there was no obvious evidence of murder, no signs of violence, no forced entry, no struggle, nothing that would immediately suggest a crime. And because Shipman himself completed many of the death certificates, his word carried enormous weight. Who would suspect a trusted family doctor of killing the very people he had sworn to protect? The answer, for years, was almost no one. Then, in 1998, everything changed. Not because investigators suddenly uncovered decades of murders, not because a witness came forward, and not because Shipman confessed. It all began with the death of one woman, an 81-year-old widow, former mayor of Hyde, a respected member of the community. Her name was Kathleen Grundy. Neither her family nor the police had any idea that her death would expose one of the darkest secrets in British criminal history. Because someone had become just a little too confident, and for the first time in nearly 30 years, Harold Shipman had made a mistake. Kathleen Grundy wasn't an ordinary patient. She was active, independent, financially secure. At 81 years old, she still managed her own affairs. She visited friends, handled her finances, and remained deeply involved in her community. To those who knew her, she wasn't someone whose death raised immediate suspicion, but what happened after she died certainly did. On June 24, 1998, Dr. Harold Shipman visited Kathleen at her home. Later that day, he certified that she had died of old age. Her family was devastated, but they had no reason to doubt the doctor. After all, he had cared for Kathleen for years. Why would they question him? Then, a solicitor contacted Kathleen's daughter, Angela Woodruff. The solicitor claimed Kathleen had recently changed her will. According to this new document, almost her entire estate, worth nearly £400,000, had been left to Dr. Harold Shipman. Angela couldn't believe it. Her mother had never mentioned changing her will. It made no sense. Kathleen was close to her family. Why would she suddenly leave everything to her doctor? Angela immediately challenged the will. Experts examined the document. The results were shocking. The will appeared to have been typed, not by Kathleen, but on Harold Shipman's own typewriter. The signature looked wrong. Handwriting experts concluded it had almost certainly been forged. For police, this changed everything. A forged will suggested motive. And if Shipman had forged the document, what else had he lied about? Investigators made a decision. Kathleen Grundy's body would be exhumed. A full forensic examination would be carried out. Months had passed since her burial. If Shipman had murdered her, there might still be evidence. The toxicology report returned with an extraordinary finding. Kathleen's body contained extremely high levels of morphine, far beyond what could be explained naturally. She had not been prescribed morphine. There was no medical reason for it to be in her system. The conclusion was unavoidable. Kathleen Grundy had not died of old age. She had died from a lethal dose of morphine. For the first time, Harold Shipman was no longer just a respected doctor. He was a murder suspect. Police began reviewing his past patients. What they discovered was deeply disturbing. Many deaths shared the same pattern. An elderly woman, usually living alone, visited shortly beforehand by Dr. Shipman. A sudden death, followed by Shipman certifying the cause himself, again and again and again. Investigators compared death records with those of other local doctors. Shipman's numbers stood out immediately. Far more of his patients died at home. Far more died while alone. Far more deaths occurred shortly after he had visited. The pattern was impossible to ignore. Families who had believed their loved ones died peacefully were suddenly contacted by police. Many couldn't comprehend what they were hearing. Their trusted family doctor, the man who had comforted them, might have been responsible for their relatives' deaths. Some refused to believe it. Others remembered small details that had never seemed important. Shipman insisting everyone leave the room. Shipman arriving unexpectedly. Shipman already present when relatives arrived. Each memory, on its own, meant very little. Together, they painted a horrifying picture. As investigators expanded the inquiry, they began exhuming more bodies. Each examination asked the same question. Was this another natural death or another murder? The evidence kept growing. Morphine, unexplained deaths, false medical records, altered documentation. The investigation became one of the largest homicide inquiries in British history. Yet through it all, Harold Shipman remained remarkably calm. He denied everything. He insisted he had done nothing wrong. He claimed the allegations were absurd. To the outside world, he still appeared composed, professional, confident. But the evidence was closing in. In September 1998, Harold Shipman was arrested. The doctor who had spent nearly 3 decades treating patients was now in police custody. The investigation that followed would shake Britain's healthcare system to its core. And when the case finally reached court, the public would learn that Kathleen Grundy was almost certainly not the first. She was simply the victim whose death exposed them all. Harold Shipman's trial began in October 1999 at Preston Crown Court. By then, the investigation had uncovered a disturbing pattern, but prosecutors made a strategic decision. Instead of attempting to prove hundreds of suspicious deaths, they focused on 15 women, each believed to have been murdered by Shipman, each connected by remarkably similar circumstances. The prosecution argued that Shipman would visit his patients, often in their own homes. He would administer a lethal injection of diamorphine, a medical form of heroin. Within minutes, they would be dead. He would then certify the death himself, recording natural causes, avoiding the need for a post-mortem, and allowing the body to be buried before anyone suspected a crime. Jurors heard testimony from forensic experts, medical specialists, police investigators, family members, and handwriting experts who explained why Kathleen Grundy's will had been forged. The evidence was overwhelming. Medical records had been altered, dates had been changed, symptoms had been added, after patients had already died. The prosecution argued that Shipman wasn't simply covering his tracks, he was rewriting history. The man trusted to keep accurate medical records had been using them to hide murder. Shipman never took the witness stand. He denied every allegation. His defense argued that the patients had died naturally, that investigators were seeing patterns where none existed, that the prosecution's case relied too heavily on statistics. But the jury wasn't convinced. After weeks of testimony, they reached a unanimous verdict. On January 31st, 2000, Harold Shipman was found guilty of 15 counts of murder and 1 count of forging Kathleen Grundy's will. The judge sentenced him to life imprisonment with no possibility of release. As the sentence was read, Shipman showed almost no emotion, no apology, no explanation, no remorse. He was led from the courtroom, still insisting he was innocent. For many families, the conviction brought relief. But it didn't bring peace, because one question remained. If Shipman had murdered 15 patients, how many others had never been investigated? Police began reopening old files. Medical experts reviewed years of death certificates. Patterns emerged that were impossible to ignore. Women in their 70s, 80s, 90s, many living alone, many in reasonably stable health, all dying suddenly after being visited by the same doctor. In response, the British government launched a public inquiry, chaired by Dame Janet Smith. It became one of the most extensive investigations ever conducted into a single criminal in the United Kingdom. The inquiry reviewed thousands of medical records, death certificates, prescription histories, witness statements, and forensic evidence. Its findings shocked the nation. The inquiry concluded that Harold Shipman had murdered at least 215 patients, and it stated that the true number was likely higher, possibly more than 250. Those additional deaths were not criminal convictions, but they represented the inquiry's best evidence-based estimate after years of investigation. The victims ranged in age from 41 to 93. Most were women, though several men were also among the dead. Some had terminal illnesses, many did not. Some were expected to live for years. Instead, their lives ended during what should have been an ordinary visit from their doctor. No diary was found, no manifesto, no confession, no letter explaining why. Only hundreds of grieving families, left wondering whether the final person their loved one ever trusted had also been the one who killed them. And Harold Shipman remained completely silent. Harold Shipman began serving his sentence at Wakefield Prison, one of Britain's highest security prisons. The man who had spent decades walking freely through hospital corridors now lived behind locked steel doors. He would never practice medicine again. He would never be released. His remaining years would be spent in a prison cell. Yet even after his conviction, Shipman never admitted to a single murder. He never apologized to the families. He never explained why he had done it. Interview after interview, letter after letter. He maintained the same position. He claimed he was innocent. For the families, those words only deepened the pain, because without a confession, there would never be closure. Then, in the early hours of January 13th, 2004, the day before his 58th birthday, prison officers entered Shipman's cell. He had hanged himself using bed sheets tied to the window bars. Despite attempts to revive him, he was pronounced dead shortly afterward. The man responsible for one of Britain's darkest criminal cases had taken his own life. With him went the answers investigators had spent years searching for. Why did Harold Shipman kill? Even today, no one knows for certain. Some experts believed he enjoyed the power over life and death. Others argued he displayed traits of narcissism, believing he alone should decide who lived and who died. Some suggested financial gain played a role, particularly in the murder of Kathleen Grundy. But that theory failed to explain the overwhelming majority of victims. Most gained him nothing. No money, no property, no obvious benefit. Without a confession, every explanation remains exactly that, a theory. While Shipman was gone, the consequences of his crimes continued to reshape Britain. The public inquiry into his murders uncovered serious weaknesses in the healthcare system. Doctors could certify deaths with very little oversight. Controlled drugs were not always monitored effectively. Death certificates often escaped independent review. Patients placed enormous trust in their family doctors, and the system assumed that trust would never be abused. After the inquiry, that changed. Rules governing controlled medications became stricter. Death certification procedures were overhauled. Monitoring of medical professionals increased. And systems designed to detect unusual patterns in patient deaths were strengthened. These reforms became known collectively as part of the lessons learned from the Shipman Inquiry. For many doctors, the case was deeply personal. The overwhelming majority dedicate their lives to helping others. Yet because of one man, for majority, public confidence in the profession was shaken. Patients who once accepted every medical decision without question became more cautious. Hospitals, regulators, and government agencies were forced to confront a painful reality. Even trusted professionals must be accountable. For the families of the victims, no inquiry, no reform, and no prison sentence could restore what had been taken. Parents, grandparents, friends, neighbors, people who expected compassion, instead met betrayal. Many spent years believing their loved ones had simply died of natural causes. Only later did they learn that their final moments may have been orchestrated by the very person sworn to care for them. Harold Shipman was convicted of murdering 15 patients. Following years of independent investigation, the official public inquiry concluded that he had murdered at least 215 people. It further stated that the true total was likely significantly higher. No modern serial killer in Britain has been linked to more victims. And perhaps the most terrifying part of his story is not how he escaped suspicion for so many years. It's how ordinary he appeared. He didn't hide in abandoned buildings. He didn't stalk strangers in the night. He wore a white coat, carried a medical bag, smiled at families, made house calls, and earned the trust of an entire community. History remembers Harold Shipman, not because he was a doctor, but because he weaponized trust itself. He proved that the most dangerous people are not always the ones who look frightening. Sometimes, they're the ones we welcome into our homes, the ones we believe are there to help, the ones we never think to question. And for more than 200 families, that trust became a death sentence. Harold Shipman died without revealing his true motive. His victims never had the chance to tell their stories, but by remembering them, and by learning from what happened, we ensure that history remembers not only the man who committed the crimes, but the people whose lives he stole.